There's somebody who I'm very pleased to have on as our guest. Jeff Welch is the Chief Executive Officer of St. Vincent's Hospital and Tenants Healthcare, Massachusetts and South Carolina Market Group, but recently came to this position, I think, from Florida.
That's right.
He's responsible for all of the various hospitals, which are 7 acute care hospitals. He's responsible for all of their operations, executive planning, and medical services. So, Jeff, welcome.
Thank you. Thank you. It's great to be here.
And we're excited to have you on the Chamber Board.
Oh, I'm excited to be there. In the 6 months I've been here, the Worcester community has been very inviting and welcoming. And despite the outlook of snow here in Worcester, it's just wonderful to be here.
So, Jeff, maybe you could tell us about your role at St. Vincent's and its kind of synergy with Tenants, other hospitals in Massachusetts.
Yeah. So. Tenet has 77 hospitals throughout the country, 3 of which are in Massachusetts, that being St. Vincent Metro West, which is 2 hospitals, Framingham Union Hospital, and Leonard Morse. And I am the local CEO for St. Vincent Hospital. And the opportunity there is that Tenet, as a company, provides tremendous resources to their hospitals to provide aggressive opportunities to bring efficiencies and quality to the community and to the hospitals.
Yeah, and in particular, St. Vincent Hospital. We were talking before the show started during the break. In Worcester alone, approximately 1,800 employees between direct and indirect.
Yeah, that's just St. Vincent's alone, and with a lot of contracted services as well.
So 1,800 is a lot of jobs, and important in terms of the economic spinoff, never mind, most importantly, the core mission, delivery of medical services.
Yeah, well, that's the great thing about St. Vincent's. It is a hospital that is looked at as a community hospital, but we have world-class services and technology that is right in our own community, and you don't have to go anywhere else for healthcare.
And in that regard, some of the service lines that you're focusing on here in Worcester at St. Vincent, you get some things that you're really trying to promote and let the people know about.
Yeah, well, we have an incredible cardiac program. Our cardiac program has a world-class structural entity of it, where we're doing some incredible things. We're doing TAVR procedures, which is in lieu of surgical procedure, which is transcatheter aortic valve replacement, where we transport the new valve within the bloodstream and there's no surgery. We also do this with mitral clips, mitral valves, and we have the new Watchman approach that no one else is doing for AFib. Mm-hmm. So we're really proud of our cardiac program, and the results of our cardiac program are stellar. We have a women's program that we're now providing nitrous oxide to our new moms. It's a great pain reliever, and we're the only hospital doing it. We have a comprehensive orthopedic program, which includes rehab and pre and post review of your procedure. We have a great cardiac cancer program.
Right. Cancer Wellness Center.
Cancer Wellness,
new building, yeah.
Brand new building right down the street from our hospital with technology like the CyberKnife.
Right, and had a family member avail herself to those services, and she couldn't speak to how great the quality and treatment was. So personally, you can say attest to a good experience and a good outcome, most importantly as
yes.
well. Some of the quality initiatives, hospital you're kind of pursuing, and that's a big push as we look at the conversation around healthcare nationally.
Yeah, quality is the focus in hospitals today. Quality, safety, and patient experience, actually. And those are the 3 things we talk about every single day. And the team at St. Vincent, the staff, the physicians, just an incredible group of caring and passionate individuals that provide incredible care every day. And that's what we focus on, and we have best practices throughout our company and our hospitals that give us all kinds of great ideas to provide that level of care.
Yeah, and I think there was some debate years past about, or concern, but in many ways it turned out to be a very positive. When St. Vincent kind of affiliated with the diocese at one point, kind of transitioned, and then became part of a for-profit healthcare system. But your quality measures, engagement in the community, I think have alleviated some of those concerns, being part of a for-profit entity. Does that change how other hospitals do their work?
It has changed a bit, but that transition has only made us better. In fact, the Leapfrog organization just rated us a letter A once again, and hospitals live and die by that rating. We got an A for the 4th year in a row. We have all kinds of accolades from different organizations, and the fact that we became not-for-profit, which kind of means we pay taxes, so we contribute to the community.
And that I think bears worth kind of repeating. So when St. Vincent became part of a for-profit system, you're one of the most significant taxpayers, commercial industrial taxpayers in the city of Worcester. So that's the thing that pays for police and fire and education and public works and library and healthcare and parks and you name it. So that's an important.
Yeah, so not only do we provide great health care and right in your backyard so you don't have to go anywhere, we also contribute to the community on many other levels.
Right. And the jobs, as we talked about, and then clearly being an engaged corporate partner and your employees out and involved in a variety of different ways. And as we know now, also taking care of the players for our new Worcester hockey team, the Worcester Railers Hockey Club, when they get banged up.
Yes, in fact, Cliff Rucker has done a great job. We're right there for him and right there for the community at all times.
Yeah, the healthcare debate is front and center of the daily conversation, and how do we, local budgets, business budgets, state, federal budgets, how do you stay kind of competitive in this market? How do you kind of make sure that the quality measures, which St. Vincent's has done so well in, kind of continue?
In the healthcare environment, it's tough to navigate, and so much is going on in government with the different programs, and Obamacare, Trump care, whatever kind of thing you're talking about. We want you to know at St. Vincent's that we care, and that we take it one step and try to be proactive in the industry and stay ahead of the game. And to do that, we have to be very efficient, very mindful of our care that we give, and that every person that leaves our hospital raves about our care. Mm-hmm. And we allow the government to do what they need to do, but at the same time, we have to focus on great and passionate care to our community.
Yeah, and let me just ask you this too, Jeff. I mean, we mentioned coming from Florida, but your experience as a healthcare executive, I think New Jersey, the Midwest. I mean, you've been around, but this is maybe your first kind of coming to Massachusetts. And in my former role as Lieutenant Governor, working with Governor Patrick, kind of first state in the country to do kind of universal health care, and certainly with a lot of the college and universities, UMass medical school here, some of them that exist around the state. And we're kind of known as a healthcare innovation state. What's been your experience kind of coming into this market and the perception and reality?
Well, I think the major difference that I've seen is really the intense focus on healthcare and doing what's best for the community. I think Massachusetts is a state whereby they have a lot of initiatives. There are great organizations in the state of Massachusetts, and great learning organizations, educational programs to train our physicians for the future. So I would say that the state of Massachusetts is different than what I'm familiar with, but that being said, I think it's a state that really wants what's best for their communities. And what St. Vincent provides is that great quality, great service, safety at a low cost. And that's what we focus on.
Right. And I mentioned the UMass Medical School. You have an arrangement with their docs that are training and coming out to serve as residents.
Oh, absolutely. We have a really extensive resident program in pretty much all the service lines. So we're really proud of that. And we're training them, we're part of their education, and we hope that they obviously stay in the state of Massachusetts because they're well-trained physicians.
Yep, yep. Well, Jeff, it's been great to have you on the scene here locally. You brought a lot of energy, presence, and that is a welcome, I think, in the community at large, and never mind in the business community. And St. Vincent is an iconic institution, has been around for a long time, and a relatively new facility in the downtown, cutting-edge healthcare, and jobs and tax base. So it's one of our favorites at the Chamber.
Yeah, well, we're
and
going,
in the community.
We will have our 125th anniversary next year, and we're really excited about that. And I want to thank you, Tim, for all your help and support for me on coming on board. I think you were one of the first people I met with, and it was a great start. And you've done such a great job with the Chamber and the Worcester community. It's really amazing what's going on here, the Renaissance, and I'm really proud to be part of it, proud to be part of the St. Vincent team, and look forward to continuing that relationship.
We'll have